This podcast is a production of iPro. The primary purpose of the podcast is to educate. Listeners acknowledge that they are not being provided any advice or services by the speakers. The speakers are expressing their views and opinions only, and not that of any company or agency for whom they work. Any reference to a specific product or entity does not constitute endorsement of that product or entity. The podcast is for private, non-commercial use only. Please visit our website at ipro.org for our full disclaimer.
Welcome to the Kidney Cast, where we focus on end-stage renal disease. The Kidney Cast is a production of iPro, a trusted partner of federal and state agencies working to measure and improve the quality of healthcare for all. We welcome all listeners, whether you're a dialysis patient, a dialysis professional, or simply interested in learning more about the End-Stage Renal Disease Network and the work that we do. We're glad you're here. I'm your host, Shazina Andiappan. In today's episode, Michelle Anderson will be my co-host. Michelle, thank you so much for being here today. Before we get started, can you tell me a little bit about yourself?
Hi, everyone. My name is Michelle Anderson, and I'm a contract manager here at iPro. I worked as a dialysis technician for over 30 years before moving into quality improvement and patient engagement work. Today, I serve as patient and family engagement lead, emergency preparedness lead, and a lead trainer for the New York State Department of Health and CDC Infection Prevention Program. I'm passionate about helping patients have a voice in their care, and I'm happy to be here today.
Thank you so much for sharing. And Michelle, we are so happy to have you as a part of our team here at iPro. The network's goal is to explore topics that matters most to the kidney community. We tend to share practical information and highlight ways that we all can work together to improve kidney care. In today's episode, we're going to talk about ESRD Network program and the 4 key priorities to optimize kidney health. Let's start with a refresher on what the ESRD Network is and what it does.
The ESRD Network program is funded by the Centers for Medicare and Medicaid Services, or CMS. And its mission is to help improve the quality of care for people living with kidney disease. Across the country, there are 18 ESRD networks. Each network works closely with dialysis facilities, transplant centers, healthcare providers, patients, and community partners to address challenges, share best practices, and support better outcomes for people receiving kidney care. Every 5 years, CMS opens a competitive bidding process for these network contracts. CMS first releases a statement of work that outlines the goals and expectations for the program. Organizations then submit proposals explaining how they will carry out the work, and CMS reviews these proposals before selecting the organizations that will lead the network for the next contract cycle. Most recently, a new 5-year contract period officially began on May 1st, 2026, marking the start of the next chapter of work to support and improve kidney care across the nation.
Beginning on May 1st of this year, iPro was awarded the National CARES contract. CARES stands for Kidney Health Analytics and Responsive Emergency Services. CARES contractors leads national emergency preparedness and response for the ESRD community. They coordinate response efforts, support ESRD networks, and help ensure continuity of care for dialysis patients, especially during emergencies. iPro successfully retained the ESRD network contracts for Network 1, 6, and 9. Network 1 is the network of New England, which includes Connecticut, Maine, Massachusetts, New Hampshire, Vermont, and Rhode Island. Network 6 is the network of the South Atlantic, which includes North Carolina, South Carolina, and Georgia. Network 9 is the network of the Ohio River Valley, which covers Indiana, Kentucky, and Ohio.
At its core, the mission of the ESRD Network program is to make sure people living with kidney disease receive care that is safe, effective, timely, patient-centered, and equitable. So what does that look like in practice? The networks are involved in a wide range of activities designed to support both patients and providers. They lead quality improvement projects, help address patient grievances and access to care concerns, and work closely with facilities and communities to promote emergency preparedness. The networks also provide education and technical assistance to healthcare teams, helping them implement best practices and improve the care they deliver. And behind the scenes, they use data to identify opportunities for improvement, track progress, and ultimately help achieve better outcomes for patients. In many ways, the network serves as a bridge, bringing together patients, providers, and community partners to tackle challenges, share solutions, and strengthen kidney care across the country.
Today, we're going to be talking about the 4 priorities guiding the ESRD network program during the new contract period. While improving quality of care remains the heart of our work, there is now an even greater emphasis on supporting the whole patient. This means focusing not only on the physical health, but also on emotional well-being, patient education, communication, and shared decision-making. The goal is to ensure that people living with kidney disease have the knowledge, support, and resources they need to make informed decisions and achieve the best possible outcomes. Throughout today's discussion, we'll explore each of the 4 priorities and what they mean in practice. After each priority is introduced, we'll hear from one of our patient facility representative, Neelan Lewis. Neelan will share his perspective on how these priorities can impact the daily lives and experiences of patients receiving dialysis and living with kidney disease.
My name is Neelan Lewis. I am a transplant recipient. I come from nearly 30 years of regulatory compliance, fiduciary responsibility, background working in banking, finance, and also working for the U.S. federal government.
Let's get started. Michelle, can you tell us a little bit about the first priority?
The first priority focuses on empowering patient and family choice. At the heart of this priority is the belief that patients and their families should be active partners in making healthcare decisions. That starts with making people have clear, easy to understand information about all of their treatment options, whether that's in-center dialysis, home dialysis, or kidney transplantation, so they can choose the path that best fits their goals, lifestyle, and preferences. This approach goes beyond simply providing information. It also emphasizes shared decision-making, effective communication, cultural sensitivity, and health literacy. The goal is to create an environment where patients feel respected, supported, and confident in making decisions about their care and their future. So how will we measure this success? The network will be tracking several key outcomes related to patient choice and access to treatment options. One important goal is increasing the number of eligible ESRD patients who start or transition to home dialysis. We'll also focus on increasing the percentage of patients who are offered a referral for a kidney transplant evaluation, helping ensure they understand and can explore all available treatment options. Another area of focus is increasing the number of transplant candidates who choose to accept high-risk kidney offers when appropriate. By expanding awareness and supporting informed decision-making, we hope to help more patients access the treatments and opportunities that best meet their individual needs.
So as someone who's lived with kidney failure, CKD, and dialysis for 13 years before receiving a kidney transplant, I understand how deeply treatment decisions affect every part of a patient's life. Patients should receive clear, honest, and easy to understand information about any available options, be they home dialysis, in-center dialysis, transplantation. Patients should also be encouraged to include a family member, a caregiver, a trusted person that supports them in this new venue of life as they discuss what is important for them to choose. Patient choice is one more than just being handed information or signing a consent form. It means having meaningful conversations, being treated as an equal partner in my healthcare management. When patients and families are truly empowered, they're more likely to feel respected, supported, and actively engaged throughout the kidney care journey.
The second priority is to improve care coordination. To accomplish this, we are focusing on strengthening communication and collaboration across all healthcare settings to ensure patient receives coordinated, seamless care. Here we are emphasizing timely information sharing amongst dialysis facility, hospital, primary care providers, specialists, and other members of the care team. Key areas include supporting smooth transition of care, improving medication management, ensuring appropriate follow-up after hospitalization, and reducing preventable hospital admission and readmissions. By working together and sharing information effectively, providers can improve continuity of care, enhance patient safety, and achieve better health outcomes. The network will measure its success by tracking the percentage of ESRD patients who has had an outpatient emergency department visit during the year and the rate of ESRD patients who experience a hospitalization during the year. The overall goal would be to reduce emergency department visits and reduce hospitalizations amongst ESRD patients.
So during my years on dialysis and throughout the kidney transplant process, I received care from nephrologists, dialysis professionals, transplant specialists, primary care providers, hospitals, and even pharmacies. I learned firsthand that patients can easily become the primary messengers between healthcare organizations when providers do not communicate effectively. Strong care coordination, it means that every provider understands the patient's current treatment plan, any special medications, test results, health risk, personal goals. This is especially important during hospital admissions, ER visits, changes in dialysis treatment, transplant evaluations, and even transitions between dialysis and being transplanted. I know for me that was critically important. Patients should not have to repeatedly explain their medical history or discover that important information was never shared. We have to ensure that we have better coordination and prevent medication errors, reduce unnecessary testing, avoid treatment delays, and make transitions of care safer, more reliable.
The third priority is about promoting whole health. And what that really means is recognizing that kidney care is about much more than managing a medical condition. It's about supporting the whole person and helping individuals living with kidney disease achieve the best possible quality of life. That includes addressing both physical and mental needs, raising awareness about the importance of nutrition, and supporting patients who want to remain in the workforce through vocational rehabilitation and other available resources. The goal is to help people stay engaged in activities that matter most to them while building the skills and support systems they need to manage their health successfully. Providers play a key role in this effort by encouraging healthy lifestyles, supporting self-management, connecting patients with community resources, and helping address mental health concerns when they arise. When patients have access to these supports, they are better positioned to achieve their personal goals and experience improved long-term health outcomes. So how will we know we're making progress? The network will be tracking several important measures. One focus will be increasing the percentage of eligible patients who are screened for depression and receiving appropriate follow-up care when needed. We'll also monitor vaccination rates, specifically the percentage of eligible ESRD patients who receive pneumococcal and influenza or flu vaccinations. Together, these measures help us evaluate how well we're supporting the overall health and well-being of the patients we serve.
I know that kidney disease affects far more than just laboratory results and dialysis treatments. It's something that can affect a patient's physical health, their mental and emotional well-being. It also touches family relationships. It touches employment. It touches their finances. It impacts independence and a patient's sense of purpose. So care teams are critically important. They must see and treat the whole person, not just simply diagnose and treat the kidney disease. Patients need help managing other medical conditions as well, coping maybe with anxiety or depression, possibly maintaining relationships now that they're an end-stage renal patient, finding reliable transportation, how to get from home back to the center. accessing healthy food, or even adjusting to major changes that happen in daily life. So mental health services should be readily available to help patients cope with the stress, uncertainty, grief, and even isolation that can accompany chronic kidney disease or CKD. Promote whole health means that we are recognizing as a patient that we're a complete person.
The fourth priority area for ESRD Network is to enhance data interoperability, meaning how health information is shared, accessed, and used across care settings. The use of electronic health records help increase efficiency, improve communication amongst providers, and ensure that patients have access to accurate and timely health information. Better data sharing can help support coordinated care, inform decision-making, and improve outcomes for individuals living with kidney disease. The network will measure its success by tracking the percentage of dialysis facilities using advanced electronic health records to measure its effectiveness and share patients' health information.
Throughout my dialysis and transplant journey, I received care from numerous facilities. I understand how frustrating and potentially dangerous it can be when one provider can't see the information that another provider already has. Patients should not have to repeatedly provide the same medical history and medication list or lab results or treatment information because healthcare systems can't communicate one with another. With the patient's permission and appropriate privacy protections, providers should have timely access to accurate and current information that's necessary to ensure they can deliver safe and coordinated care. Effective data sharing is particularly important for dialysis patients and transplant recipients, chiefly because of medications, lab values, treatment changes, infections, hospitalizations, and other health events that can quickly affect the patient's condition. So missing or outdated information can lead to treatment, medication errors, duplicated testing that may not be covered by insurance, delay treatment, and help to avoid complications. So better interoperability, essentially, it'll give the entire care team more of a complete picture of the patient's health, help them to support safer transitions between care settings, and enable more informed and personalized decisions. Technology is our friend. At the end of the day, working to improve patient outcomes is job one.
These priorities support a patient-centered approach to care focused on improving quality, safety, and outcomes for patients living with kidney disease. Michelle, thank you for co-hosting today's episode with me and helping us explore these important priorities.
You're welcome.
Neelan, thank you for sharing your experiences and your perspectives and for helping us understand what these priorities mean from a patient point of view.
Thank you. I appreciate that.
And thank you to our listeners for joining us on the Kidney Cast. We hope this discussion has been informative and insightful.
Thank you, Shazina. It has been a pleasure talking about the ESRD Network program. If you'd like to learn more, visit our website at esrd.ipro.org. That's esrd.ipro.org. And if you're new to the ESRD community, I encourage you to check out our Empower Yourself resource. It's a great introduction to the network program and the support and resources available to patients and families.
If you enjoyed this podcast, please leave us a comment and subscribe. Please let us know what topics interest you or what you would like to hear from us. You can do this by emailing us at esrdnetworkprogram@ipro.org. That is it for today's episode of the Kidney Cast. I'm Shazina Ndiapan.
And I'm Michelle Anderson.
We will be back soon. Until then, we'll be working on better healthcare realized.